Hi Taha, how are you?
Hello, I am fine.
Could you please help me with your full name?
Okay, my name is Taha Arif Sinarwala,
Okay.
and I'm
Where-
from Maharashtra.
You're
And
from
in
Maharashtra.
Maharashtra, I'm from Nasik.
Okay, okay. Um, when did you realize that you want to become a doctor?
I think I realized it during the 10th
Okay,
because I was really interested in biology and not the botany, but I was really interested in human biology. And I
okay.
was like, I need to study more about this. And that's why I told my parents that, you know what, I want to do medicine.
Hmm.
And they were like, okay, yes. Firstly, we had some like discussions like, okay, should you do medicine? But like, yeah, eventually I convinced them for medicine.
Okay, so since 10th standard, you had this dream to become a doctor and serve the nation.
Yes.
All right. How did you plan your MBBS or how was your medical journey till now? Because choosing a country or a university is not an easy task.
Yes, that is true. It was very ups and downs for my medical journey.
Okay.
Firstly, I was very interested in medicine, so I thought, okay, I'll give NEET. But
Hmm.
then my NEET result wasn't the best, so I couldn't get like a seat in India. And
Okay.
then again, I was very stressed. So what to
Okay.
do? And then Siddharth sir was an amazing counselor for me because he gave me
Okay.
like a option to go to Georgia,
Okay.
and because of that, then I went to Georgia and I started studying. I really enjoyed it, and
Okay.
now I'm here.
Could you please help me to know that what was your NEET score and why couldn't you get the admission in India?
So my NEET score was 200, and
Okay.
it was quite low. But
To-
at that time, I think like it's the same for all students that it's quite difficult to understand how to study in the beginning. But
Hmm.
then as you get older and as you get into medicine, you learn how to study more efficiently and like what you are more interested in.
Absolutely, absolutely. So, why did you choose Georgia? I mean, why did you not choose any other country, and why that teaching university, Geomedi University only?
I had a lot of recommendations from people. I saw a lot of different countries, but for Georgia, I thought like it was more open. It has a better quality of life, and the main reason why I came to Georgia was I saw that the people here, even the students and the teachers, they were really amazing.
Okay,
They weren't like other universities where like teachers would just not help you with your doubts. Instead,
mhm.
here teachers would stay out after lectures for maybe like an hour or two and
Okay,
still help me with like the doubts I had. And all
okay.
of this was told to me by Siddharth sir and like some other students that I reached out to,
All right.
and that's why I made the decision.
That's great. That's wonderful because once you make a wise decision, because your life is at stake and your future is dependent that what you are doing presently, right? So, how was
Yes.
your parents' reaction, and what did they tell you when you told them that you want to pursue MBBS from abroad? Because why I'm
First,
asking this, because a lot of parents do not give that much preference of studying MBBS from abroad. Number one, they will be far from their family, and for 6 years they will be far from the family and will be visiting the house only for 1 month in a year. So, how was their reaction?
in the beginning, they were kind of skeptical about it. They were like, okay, Georgia, we don't even know the place. And it was difficult to convince them. But when we got the admission, they came with me for the first time I came to Georgia. And
Okay.
then they saw the place, and then they were also very interested. They're like, okay, yeah, it looks safe. There are a lot of Indian people. There were
Hmm.
some people I knew from before. So that helped me convince them. And
Or
then they were also assured.
and how are they feeling at the moment because you have cracked USMLE examination?
They feel really well. My mom constantly tells me like, okay, everyone, like some of my other friends in India are also doing medicine, right?
Okay.
So she constantly tells me that these other people, they've also taken you as an inspiration, and now they're also studying for USMLE. And I
Hmm.
feel that that's like what I wanted to do. So they feel very happy for
They
me.
feel very happy, rather proud, I would say. They are very proud of you.
Yeah, they're also very proud.
So your decision of doing I mean, the dream which you had from your 10th standard is not scattered, and you stood by your word, and you proved that you have done a wonderful job by now.
Yes.
Okay. So, how was your experience at teaching University Geomedi when it comes to the university, when it comes to the academic, the lecturers, the teachers who are teaching over there, and what kind of equipments are used over here to teach in the classrooms?
Okay, so firstly, when I talk about like the teachers, I really enjoy the teachers. Usually, like some of the other like universities, what teachers do is they will just give you a lecture and then they're done for the day. But
Hmm.
here, I felt very at home because like if I had any questions or if I wanted to know more about something, I could talk to
Yeah,
them and they would stay for like longer. Even if they had like another lecture, they would give me at least like 15-20 minutes
yeah.
and I could ask them about like the questions I had, and if I was interested in something, they could also point me to like research papers or like other researches that they had. And furthermore, one more thing that I was interested in was research. So I asked a lot of teachers about like, okay, can I come to a research? I just want to see what's up, and yeah, they allowed me for that too. So
Okay.
it was a good
So
experience
did
with
you
teachers.
also get the tutorial classes or the extra classes in the classroom and also how was your experience there with the sometimes you don't understand anything at once, you know, sometimes what
Yeah.
happens that you miss the class or something is really difficult for you to understand. Did you get tutorial or the extra classes by the teachers over there?
So it was a little different for me. What I did was if I didn't understand something, I would go home, read about it a little, and then
Hmm.
come back to the teacher. And if I still didn't understand it, then yes, they were very, forward with like, okay, I can teach you a little more.
Hmm.
And they were all for like helping the students.
All right. So, like in other universities, you have a group of students which remain the same throughout the 6 years. Is it the same in Georgia Geomedi University as well, or you have,
Yes, it is
or the
true.
groups keeps on shifting by first year it's different group, second it's different group, or like that?
No, so usually in University Geomedi, I also like this thing a lot that the students you come in or like the groups you make in the first semester will have the same group till like the last year and the last semester.
Okay.
So you really get to know them and then you really get to make like good friends.
Okay.
For other universities, I know that there are other problems where like the groups keep on shifting. You
Hmm.
also need to select your own subjects and that it's a lot of hassle.
Hustle is always
Sometimes people don't get the subject they want and like not the teachers they want.
there.
But
Right.
here it's nice that the university does everything for you.
Hmm.
And the only thing you need to do is like attend the university, make friends, and also learn at the same time.
Right. So the group of students whom you had and studying right now, are there some Indians as well, or they are from the other countries?
So there are mostly Indians here, and I feel like it's a good thing because it gives like a very homely vibe.
Yes.
And you can also talk to other people. And one more very important thing I found was it gives you a lot of exposure.
Hmm.
Like before in India, I would go to like school or college, I would only meet people from like that region. But
Right.
here it's people from all the regions. So we have people from the south, we have people from Delhi,
Okay.
and we have people from Gujarat and like all over. So I
But
think
all
that's a
over,
really good blend.
you just don't find out that they are from the various states of India. You just find out that they are from India. It's a home country.
Yeah, that is true. At the end of the day, like when you're outside of India, we're all Indians and we need to like care for each other. So I think that is
That's
important.
important. So, I mean, when you're preparing for the USMLE, so did you prepare by yourself? You took some guidance, or the lecturers of the Geomedy only helped you, or do they help students in pursuing or preparing for the USMLE examination?
So they help you in a way where they can give you some academic guidance,
Okay.
but the process of like in-depth studying is up to you. So you can always come to them for doubts and
Okay.
like if you have any questions. But the major thing you need to study on your own
Okay.
because even for like India or any other country, the syllabus for the USMLE it's quite vast. So it's like you'll need another like different classes to actually attend them.
Hmm. Hmm.
So
So,
I could
did you
always come
take
to them
any
with doubts.
preparation, or someone guided you, or when you were doing your self study, as you said that the maximum studies has to be done by your own self, it's a self study
Yes.
something. So, I mean, how did you prepare, and how were you able to crack it? Because it's a big achievement for your life to crack it only in one go.
So for me, what I did was I took the first semester to just understand the university, understand the country, and like how to study.
Hmm.
And then I started from the second semester.
Okay.
It's not that I put like 8 hours or 10 hours every day from the second semester or the first semester. I
Okay.
would start slowly. So I would study for maybe 1 hour, 2 hours,
Okay.
finish what I was taught for the university, and then supplement it with what like the USMLE wanted.
Okay.
And I would keep on doing that. And eventually I noticed that because I was studying for the USMLE, my university work kind of got easier. And then I had more time to study for the USMLE.
All right.
So I, after doing this for like a few years,
Hmm.
around the third year when I was like eligible for the USMLE, I gave it in the first attempt.
All right. USMLE, they have certain stages as well. They have certain steps. So once you plan that you don't need to study for 8 to 10 hours by just going through the books all day. How did you plan it, and what are the USMLE steps, the process? Help me with that, please.
Okay, so the first step is step one, and you can only give that after you finished like basic sciences of your university. For Geomedi, it's like after 3 years.
Okay.
And after you finish the first step, you can go with the second step, which is called the step 2 CK, which is more about like clinical knowledge.
Okay.
And that you can give any time after step 1.
Okay.
So once you finish the step 2 CK, after that, you need to build your CV and apply for like a match. There is a little misconception that the match and like the interviews is step 3, but it's not completely true. Because after step 2, you need to directly apply for a residency, which is like the PG, and you need to make a good CV for it.
All right.
And after that, you can give step 3.
All right. So the process is simple, but students don't take it too simply, because
Yeah.
of course, the examination is not an easy one, right? So how did you feel when you got to know that you have cracked that exam?
I was very happy. Like,
So were you assured of yourself that you would crack it, or you were in dilemma? I mean, how was your emotions were going that time?
so for the USMLE, right, it's very different from like the FMG exam or like the PG exams. For the USMLE exams, you have like a very clear set of like things you need to know, and the like examiners themselves post out like practice questions, and each exam that you do for practice is like 6 or 7 hours.
Okay.
So based on that, you have a rough idea of where your score would be, and that if you will pass. So it was very stable for me. I wasn't very nervous, but to actually see it on my email that, okay, yes, I passed with a good score was like, it was really amazing.
Right. So also tell me that how would you tell someone to prepare for the USMLE examinations, or you would tell them that be calm and composed? See, there are two methods, I would say. If you'll say calm and composed, other one would say, let me not study. If you'll say keep
Yeah,
on
yeah,
studying,
yeah.
the other one would say, let me study for 12 hours. So it's a mixture of both. Right. So how would you tell
Yeah.
your younger ones, or I would say the new students who want to prepare for USMLE examination or wants to give, what would you suggest to them?
The first thing I would suggest is to just understand yourself, that what type of studying works for you. For some people, like very long hours for like a weekend, then like a 2-day break will work. Or for other people, like less time every day would work. So
Okay.
once people understand that, the only thing they need to do is be very consistent with what they're doing. So it shouldn't be like, okay, today I had like university and I'm very tired, so I'll skip for today. Because then that excuse will like go for tomorrow and like the day after. You need to be very concise, and you have to have a plan that I will take a break on this day, and every time except for that day, I'll study and finish the goals that I set for myself.
Okay. All right. Um, what is your dream specialization for PG?
So I would like to go for psychiatry,
Okay.
because I'm very interested in psychiatry. I like helping people, and for me, I think psychiatry is still one of those fields where you can actually devote some time to the patient,
Right.
because each session is around like 1 hour or like 45 minutes. Wherein for other specialties, it's quite less. So you get like 5 minutes, 10 minutes, and you need to understand them, diagnose them, and then you're done. But for psychiatry, you have a patient and you keep them for a long time. You get to
So,
really understand them.
do you think that you would definitely get that number of clinical patients with you, or that number of patient flow is there?
Yes, it is
Did you
quite a
do
lot
any
of
survey?
patient flow.
Because when you are saying yes to that, so I think that you have definitely done some survey about it. So did you do some survey, or did you find out that the ratio of percentage are there for certain patients who are dealing with such issues?
Yes, so I recently wrote a paper, and we're still waiting on publication for this.
All right.
But we checked how income affects like depression rates, and what we figured out was overall there's around like 15 to 20% of the US population which are affected by depression alone.
All right.
And then when you consider anxiety, like schizophrenia and all of these conditions, then that number goes even higher.
All right. Yes.
So for medicine, I think it's that you always have patients, and it's like a field which will never like be taken over by anything else. So if you like anything in medicine, I think it's best to give it your all and work towards like achieving the best in that field.
So definitely you would like to help people so that they can be mentally stable and
Yes.
they don't come across such illness where people think that they have gone mad. Right. So there's a lot
Yes.
of difference
Yes.
between going mad and suffering from these ailments.
Yes, that is
What
true.
is your comment on it? Because people, if someone is depressed, they would say, "Oh, they are saying that just like that," and he is just speaking this word out of nowhere. What do you suggest? What is your outcome for this?
So for depression, there is a very strict guideline that you need to have like a change in appetite, change in sleep patterns, change in concentration, change in energy, and all of these things.
Right.
So once someone classifies for depression,
Yeah.
only then can we say that okay, they are actually depressed, like clinically depressed.
Right.
If someone is simply feeling sad for some time, then that isn't really like clinical depression, and they can still go to a therapist, but it's not like they need medications and everything.
Hmm.
So yeah.
Yeah. Could you please also help me to understand how are the hospital tie-ups in teaching in Georgia rather, and what are the hospital tie-ups with the teaching university Geomedi? Did you go to the university, the hospitals to do the patient work, and did you meet any patient? How was your experience there?
So for patients, I have seen a lot of patients. And one good thing about Georgia is that I'm not limited to one hospital.
Okay.
Every rotation that I have is in a different hospital. So I really get to understand like how different healthcare like hospitals are.
Okay.
Some of them could be really big, and some of them which cater to like a smaller population, which is like a minority field. They would have like a different type of approach to patient care and like the structure of the hospital. So it's
Right.
quite diverse in how you get taught and like the interactions that you have.
So approximately how many hospitals you have gone or you had visited?
It would be difficult because it's quite a lot. Like every subject you go to a different place, and
So it's like 20, 30. How many hospital tie-ups do you think that this university has?
I think at least 15 or 20.
Okay, 15 to 20. So that's a good number because the
Yeah, it's
patient,
a really good
wherever
number.
you find the patient flow or the clinical exposure, will definitely find good number of hospital tie-ups.
Yes.
Hmm. What are the facilities the Geomedi University provide to the students who are living in the hostel?
In the hostel.
Yeah.
Yes. So the hostel is really good. I was in the hostel for the first year myself.
Okay.
And what I realized was the hostel was a good place to make friends, first of all. And after that, the hostel kind of gives you a lot of important things that, you know, when you first come from India, it's difficult to adapt.
Yeah.
So they have like cleaning services, they have like mess food. So you don't really need to clean or like cook for yourself in the first year. So you can get adapted to the country a little more easily.
Okay. And have you experienced or also you have come across the um, hostel facilities apart from the academic? What are the co-curricular activities you participated?
So like the fun activities for the hostels, right?
Yeah.
So I have this one story where me and my friends from the hostel, right? We would play hide and seek in the hostel, and
Okay.
it was really good because like the hostel wardens, they were really nice with us, and we made good friends with them. And then every weekend we would play something similar. So we would either play Monopoly or sometimes we would play hide and seek.
Okay.
And just there's one guy knocking on every door. Is like, hey, is this guy here? And then we're like, ah, no.
Okay. So co-curricular activities की अगर मैं बात करूँ specifically, so you have also come across the activities apart from hide and seek? What other activities you have participated or students can participate?
So the university also hosts a lot of like events.
Okay.
So there's like the Freshers event. There's like holy events. There's Christmas events. Recently, I had like a secret Santa
Okay.
where someone gifted me like a good book.
Okay.
And a lot of these festivals, they have like their own like event. So there is a Diwali festival.
So
There
all
is a
festivals are celebrated with a good
yes,
enthusiasm, the way they are done in
yes, yes,
India, right? Okay. So yeah, I can say that not only the academic part, but yes, the university also helps you to keeps you healthy in terms of being physically fit, and also
yes,
gives you a chance to celebrate the festivals so that you don't miss your family more.
yes. That is true.
Okay, all right. How was your experience with education vibes? How you got to know about us?
So I got to know about Education Vibes and Siddharth sir on Instagram.
Okay.
And one day I was just randomly on Instagram and I saw like, okay, you can go to Georgia for studying.
Hmm.
And I reached out, I sent them a message, and they were really nice. They helped me with all the different questions I had. And they were very forward with like the admissions, and like there was a lot of transparency in the process.
Okay.
And I really enjoyed it. Like
Okay.
from the time I wanted to get an admission till the time I actually got an admission, I never felt like I was lost or like I didn't know something.
Hmm.
And there was always someone there with me.
You must be having your juniors in your university who are pursuing first year and second year. What advice you
Yes.
would give it to them?
I would advise them to start studying right now.
All right.
That to actually put in effort right now, because even for the FMG, the sooner you start, the less effort you need to put in.
Absolutely.
Because if they start from the second year, every day maybe they can put in 2 hours.
Hmm.
Or if they wait until the sixth year, then every day they need to put in 12 hours.
Okay. All right. So, what subjects did you study in your 6 years? Could you name a few for the viewers?
So I studied pathology, pharmacology, physiology, biochemistry, histology, anatomy,
Okay.
and then I studied a lot of clinical subjects. So it was anesthesiology. Right now I'm studying PMNR, which is physical medication and rehab.
Okay. Okay. So
And
which one was your favorite or is favorite at the moment? Which one did you
I,
find the most interesting one? Because you want to go to the psychiatry part, right? So your
yeah,
focus must be towards a subject which would lead you towards specification.
yeah, that would have been true. But for me, the best subject I had was physiology,
Okay.
because I studied physiology for like 3 years.
Hmm.
Oh, sorry, it was 3 semesters.
Okay.
And the professor was really amazing. Like we would talk about like ideas in physiology and like how different processes still to this date are not explained.
Okay.
And we would really have long conversations. Sometimes even after like lectures, we would sit down for like 1 or 2 hours, and he would teach me that even though this is not explained, this is a possible theory that we have. And
Okay.
then we would just discuss bounce of ideas.
So the
So
lecturers
I
are
feel,
so experienced that they would not let you go like that. Even after the classes, your lecturers, they would give their time for you to study, for you to understand the concept and the theories in that profile.
yes.
Okay. What advice would you give to the students who are planning to pursue their MBBS from Geomedi, and what some points you would give it to them about the university?
So firstly, I would tell them that come here with like an open mind, and understand that you are going to be away from your family. So there are some things you would also need to do by yourself,
Right.
and that we're coming here for studying, and that should be the first goal.
Hmm.
So you should put your everything into studying. That
Okay.
doesn't necessarily mean that just stop going out completely and don't enjoy
Right.
life. That is also what you should do.
Content. Right.
Because the second thing after like a medical education that University Geomedi or Georgia
Hmm.
gives us is like a good mentality.
All right.
It matures you in a way where you're spending 6 years here and you're around different people, so you
Hmm.
can really develop yourself. So that is also one opportunity that I would like everyone to kind of understand.
Hmm. So this is your sixth year, your final year, right?
Yes.
And then you'll be having an internship.
So for me, this year is considered my internship.
Okay.
the 6th year,
Okay.
I will get like a letter of internship from the university.
Okay.
And after this, what I plan on doing is directly going to the US in August, so that
Okay.
I can do like some United States clinical experience
All
after
right.
like my graduation.
Okay. Why US only? Why are you not coming back to India?
For me, I really wanted to do psychiatry, and I know that in US there is a lot of research for psychiatry,
Okay.
and that it is really at the forefront of medicine in the US. So they're developing new techniques and just
Okay.
have new ways to treat and diagnose mental illnesses.
So
So I
you'll be
wanted to be a
learning
part of
new
that.
theories, you'll be learning new ways, you'll be learning new
Yes,
techniques to treat patients over there.
yes.
Okay, okay. It was really nice talking to you, Taha. All the very best for your future endeavors, and the education vibes wish you good luck. And thank you for joining us today. Have a great
Thank you
day.
for having me.
Thank you. Thank you so much, Taha.
Thank you.
Thank you. Bye.